Good evening, and thank you all for taking the time for this very important conversation about your health and the overall health of our community. COVID has changed the way we do a lot of things every day. It has also had a devastating impact on communities of color. We know this virus is relentless and deadly, regardless of your age, gender, or zip code. But like many issues that plague our society, our residents of color have been hit the hardest. Unfortunately, the vaccine rollout is underway, and we have a new president who has done more in 24 hours than his predecessor has done in the past 10 months to help ensure that everyone who wants to be vaccinated can be vaccinated. In Denver, we are approaching vaccine distribution much like we did COVID testing, with an equity lens and a focus on making it easily accessible to the people in neighborhoods often overlooked or more severely impacted. But our efforts will not be impactful if we have not earned the trust of our residents, who in many cases have very legitimate reasons for their distrust of this vaccine and the healthcare system in general. That is why I've assembled this esteemed panel of my peers to help inform our conversation with facts and context so that you can have confidence in making decisions around what's best for you, your family, and your community. This is the first of a series of conversations we'll be having with our communities of color, including our Latinx, Asian, and Indigenous people. Tonight's panel is focusing on the African American community. Now, our first panelist is Terry Gentry, a historian and volunteer docent with the Black American West and Heritage Center located in Denver's historic Five Points neighborhood. She will provide the historical context for our conversation. Many of you have heard about the Tuskegee experiment and the forced sterilization of Black women. Terry will help us all understand how history impacts our decisions today. I'm also excited that we'll be joined by a good friend, a well-known Denverite, Dr. Reggie Washington. He is also the Chief Medical Officer of the Rocky Mountain Hospital for Children and has nearly 50 years of experience in the medical field. He's going to help us keep it real tonight with his perspective and insights. We're also privileged to have another well-known medical professional, an internist at Kaiser Permanente East, Dr. Terry Richardson, and lead physician for the Virtual African American Center of Excellence. She is also vice chair of the Colorado Black Health Collaborative. Dr. Richardson will help us look ahead to action. And I am so pleased to bring a new Denverite to the screen tonight to help us talk through this. Her name is Gabrielle Franklin, a reporter for Fox 31 here in Denver. She is here to share her perspective as a COVID survivor. So we're ready to get this started. I want to thank each of our panelists for taking a few minutes to be with us tonight. And so we're going to get started with Terry Gentry. And Terry, I'm excited as anything to have you here to talk about this issue. And I want you to lay the foundation, if you will, about the foundation of why there's such distrust between African Americans and the healthcare system. And I know you can take us back a little bit. So I'm gonna give you a little time to do that. Welcome, and thank you for joining us.
I appreciate the invitation. Thank you so much for having me. So our issues with healthcare go back into slavery. I don't know if you're familiar with Dr. Marion Sims, who is the father of gynecology, who experimented on Black women and did some horrific things to our bodies to get gynecology on the table. And then you had mentioned the Tuskegee experiment where they injected our Black men with syphilis, and a lot of the men died having no idea what had been put in their bodies. And then the eugenicist issues with women and birth control in the 1940s, et cetera. And we've had some other horrific health issues that we faced as we've moved forward in the 1970s and 80s. And we finally are recently having a slight decline in the number of African Americans that are dying from catastrophic health issues, but we have a disproportionate number of our folks suffering with all kinds of health issues, including heart disease and stroke. So we have these extremely high numbers, and then we have lack of access to resources to cover that. So we hear about the food desert in a lot of our communities, but it's not only a food desert, access to grocery stores, it's also access to other resources, including medical health. One of the fortunate things in our community is, and you'll be talking to Dr. Terry Richardson, is the Colorado Black Health Collaborative is working so hard to try to change some of those narratives in our community. But I'm even thinking back about Dr. Justina Ford, one person in particular who is where the Black American West Museum is located, in her former home. Dr. Ford graduated from Herring Medical College in 1899, and she and her husband, Reverend John Ford, came to Colorado because he was called to minister at Zion Baptist Church. Dr. Ford was granted her medical license in 1902, but denied membership to the Colorado Medical Society, and was not granted that membership till 1950. We have other stories around the country like that, where there's a disparity in being granted access. And a lot of us we do well when we have people that look like us taking care of us. And we only have a 5% graduation rate of the medical schools. And I think Latino communities about 5 or 6% graduation rate. It's hard to get us into the schools because of the credentials that are required and some of the specific things that happen. So the disparities in African American, Latino, and the rest of the community with access to education and also access to insurance and cost-effective medical services these days is off the chain. And so a lot of, especially our frontline workers and a lot of our folks that make minimum wage, that make less than $50,000 a year, cannot afford medical insurance at all, cannot afford it. And if you're trying to pay out of pocket the cost of medical services, you would be absolutely floored at how much money you're trying to pull out of your pocket, trying to decide if you're going to pay rent versus paying for a medical procedure. So this is a long-term thing. The other thing with trust is that there's so much implicit bias mixed into it, that we have a disproportionate number of Black women dying in childbirth because they're not listened to when they're having that child. They may complain or express concern about something that's going on with their body and no one's listening to them. And then the stress of our lives, a lot of us with the high stress jobs that we carry and things like that really impact our health. And unfortunately, such things as mental health are criminalized. So we have a lot of folks that are imprisoned or killed or some other horrific thing happens to them when they have a mental health issue. So there's not a lot of trust in the system because the system continues to fail us and continually treats us as if we don't have any issues that we're not. I think sometimes some of those ideas about not considering us human during slavery carry forward. So when we try to speak up, we're not heard, we're dismissed. And that really plays a big role in our healthcare. So it's hard to trust anyone that comes forward trying to give you some relief.
Get on muted. We get the instructions, don't mute yourself, and I did and forgot I was on. But thank you for that, Terry, because you lay the foundation of why there's such distrust. I think a lot of people don't understand why African Americans have such distrust. I'm gonna bring in one of our medical professionals, Dr. Reggie Washington. Thank you, Dr. Washington, for joining us tonight and giving up your time. We have laid a foundation of why there's such a lack of distrust by the African American community into the health profession. You're one of our well-respected health professionals in our community, and you have been, of course, following and engaged in the distribution and advising not only myself but other government officials on the COVID vaccine. Should we turn our trust to this vaccine, and why is it important for us to get vaccinated?
Well, first of all, thank you for allowing me to participate in this panel, and I hope that we're able to shed a light on some of the issues dealing with the COVID vaccine. But before we do that, I would like to just set the stage for what we know about the COVID virus.
Yeah.
There's some things out there that I think your panelists and others need to really appreciate. The first is COVID has only been around for 13 months. It's a very young virus, and it's newly introduced to the human race. Now, what we've learned about it is quite fascinating. One of the facts is that it's extremely contagious. It's very easy to catch COVID if you're exposed to it. You might ask why that is important. Well, there's certain people in our population who could work remotely. We call them essential workers. The essential workers cannot work remotely. And the importance of that is, it doesn't matter if you're essential or not. It matters if you have to go to work. If you're a janitor, if you're in food service, food supply, you work in a hospital, you're an emergency person, any of those issues, you have to go out and work and be exposed to people. So keep that in mind. Also, we know that if you don't have a medical home, if you don't have a home where you go to, and not only when you're sick, but when you're well. If you have diabetes and someone is monitoring your diabetes, not only when you're sick, but when you're well. If you have high blood pressure, if you have any of these chronic issues, if you have a medical home. If you don't have a medical home, you more than likely show up at an emergency room where it's crowded. You don't have someone who's really interested necessarily in your overall health, just the one thing that got you there. And so we need to realize that if you don't have a medical home, COVID really takes advantage of that. If you need public transportation, so you're not allowed to get a one-on-one when you get to work, that exposes you to the COVID virus as well. But the most important thing that we've discovered is that if you have pre-existing conditions, that is, if you're obese, if you smoke cigarettes or have a history of cigarette use, if you have diabetes, if you have high blood pressure, if you're elderly, all of those things, if you contract COVID, COVID makes you sicker than if you have none of those things.
Yeah.
Now, what has happened, however, is that COVID has shed a very bright light on the inequities in our society as well as in our healthcare system. So that if you have delay in treating and getting treatment, you have delay in getting someone to listen to your symptoms, if you have delay in even admitting that you have COVID. We've had patients who come to us who've been sick for 4 or 5 days, very sick, and they won't come to the hospital. We've had people who say, oh yeah, I know I have diabetes, but I haven't been taking my medicine. The stories go on and on. So it's a two-way street. You have to have some responsibility for your own health, and then you have to have healthcare providers who are really, truly interested in your health. So what we have found that it's more likely if you're a person of color, particularly if you're Black, you're more likely on the wrong side of these social determinants of health. You may have more likely to have pre-existing conditions. You're more likely not to seek medical care. You're more likely not to have confidence in the medical system. The medical system's more likely not to treat you as a human being. COVID doesn't care about any of those things. The fact is COVID will make you sicker. So that is why Blacks are more than likely than whites to contract COVID, more than likely to die from COVID, more than likely not to seek immediate care for COVID. Now, I say all that to say vaccines are going to help. But if you don't take the vaccine, it's not going to help. Others on this panel will explain to you why vaccines are safe. They've been studied in people of color and others. We have a high level of confidence that the vaccine will be helpful. On the other hand, we also know that it's going to be difficult for the vast majority of people to immediately get vaccines. And therefore, we have to continue to do the things we know work. You have to socially distance, you have to wear a mask, and you have to wash your hands. So with that, I'll just say I appreciate being here, and I look forward to answering any questions people may have.
Dr. Washington, that was very, very thorough. Appreciate that. Let's get Dr. Terry Richardson in here, one of our natives, native daughters who is in the medical profession, and give us your perspective. That was pretty solid, and I know you have some thoughts on COVID as well.
Yes, I think Dr. Washington said it all, but when I'm going around to the community, I like to emphasize to people that COVID does not play. This is a disease that like we've never seen before. There are some people that get very few symptoms, but there are some people who get it and their symptoms linger on. So this is not something to play with. And I appreciated Terry Gentry giving that background on some of the reasons why the Black community may be a little bit hesitant to get the vaccine. This vaccine, as medical professionals, we really feel like this vaccine will give us an opportunity to get closer to the norm. We may never get back to exactly life the way we once had it, but this vaccine will give us an opportunity. And we've heard about the Black community being hesitant to get the vaccine in some respects, but I think that we have people at both ends of the spectrum. Some people are in line. I had patients contacted me before the vaccine was even released saying, when am I going to be able to get in line? And there's others who just don't trust it for the reasons that have been mentioned. The Tuskegee experiment is what people mention the most. And I always try to tell people that the men were not injected with this with the syphilis infection. They simply were left untreated even when penicillin was available. And so that study or experiment, as we like to call it, went on for 40 years.
Yes.
But this is a different day, different time. We have a process for distributing the vaccine. We know there's phase 1, 2, 3, but I tell people this is a very dynamic process. We have 330 million Americans, and we don't have that much vaccine right now. If everybody today raised their hand and say, give me this vaccine, it's not going to happen today. It's not going to happen tomorrow. But we do have a process. It's very dynamic. You guys know that the 70-year-olds were in phase 2. Now they're in phase 1. But you have to get in line. And I tell people you may not be at the front of the bus, but don't be at the back of the bus on the vaccine. When it's your time to get the vaccine, they say it's your time to get in line, do that. Don't be afraid. You have people that've got our back. We have medical professionals, African-American medical professionals that are making sure to look in and see what's going on. We know this vaccine is safe and effective. So I'm going to stop there because I'm sure there's lots of questions. And sometimes I get carried away and talk too much, but that's what I'll give right now.
Dr. Richardson, we are so honored to have you here. I'm giddy about this panel because I've known all of you, except for Gabrielle, our next speaker, for most of my life. And I'm excited that you all are here to share the community. Let's look at these numbers, Gabrielle Franklin, as we bring you in. Today in America, 24.6 million people have been infected with the virus. We've had 409,000 deaths. In Colorado, we have 381,210 positive cases. We have lost, unfortunately, we've lost 5,440 people with COVID. In Denver, Colorado, in Denver, Colorado, we've had 53,962 cases in Colorado, and we've had 482 deaths. Blessedly, you are one of the people who contracted the virus, and you're here, and you're healthy. You got through it. You mind sharing your experience with the public?
Not at all. Thank you.
And welcome to Denver.
Yes, sir. Thank you so much. I appreciate you guys and just including me in this esteemed panel with these guests. It's been such an honor to be included among the group. So as the mayor mentioned, I'm fairly new to Denver. I've been a Denverite for about 6 months now, but about 7 months ago, I contracted COVID-19. And to this day, I still don't know how I got it, but I'm glad that I'm here today to share this with you guys because as a journalist and just as a Black woman, I've been sort of taken aback by the number of people who are my age, the people in the millennial category, who are really reluctant to get a COVID-19 vaccine. And the number one thing I always hear from people when I ask them, well, why don't you want the vaccine? They're saying that they don't trust it as well, as we've heard from our panel today. But every time they say that, I ask them, well, do you want COVID? And many people are thinking, well, it's just the flu, I'll get over it. But I'm here to tell you that unfortunately, you may not. We know that people are dying from this disease. It's very serious. As you heard the doctors mention, you can get really ill from it. And I'm glad that I'm still here, but I did get pretty sick. So I want to unpack that a little bit briefly and just explain to you guys a few of the symptoms that I've had and the journey to sort of get over COVID-19. So back in July, I'm not sure whether I picked it up when I was working. Journalists are considered essential workers, and we try to work from home as much as we can. But there are some stores that, you have to go out and get video for or be in the field for that. But right before I left the area I was in, which was Illinois, to come to this job, I found out that I had COVID. So ever since then, it's been sort of an uphill battle. Different things happening. For me, when I found out that I had COVID, I figured that I had a cold. I was coughing and sneezing a bit, but I didn't think that it was COVID. I took some cold medicine and sort of got over it. Distanced myself, of course, but had on a mask every place that I went just to make sure that I wasn't spreading it. But for about a week, I just felt like it was a cold. And then a little bit later down the road, I could tell because I lost taste and smell completely. And I knew, okay, this is different. And from there, things gradually got worse. For me, my biggest symptoms were just the chest and the breathing issues. That's something that unfortunately, here 7 months later, sometimes that issue still shows up. I would say before that, I didn't have any pre-existing conditions. I was fine, but now I have one of these, if you guys can see it, it's an inhaler. Never had that before. It's something that I've had to use pretty often just to sort of alleviate that. On top of that, a lot of people hear about the symptoms, but they don't think about what you need to do to get over those symptoms. We know for COVID, there isn't a cure yet, but there are some over-the-counter solutions that you can take to try to alleviate that. But imagine being on cold and flu medicine, guys, for 6-7 months. That's not fun. If you've ever taken cold medicine, you know how that stuff can make you feel. So it's just something that you really don't want. Every time I tell younger people, please take this serious, because not only is it something you don't want to go through, you don't want to pass that on to your family members. And that's definitely a possibility also. I do believe that in the process, I inadvertently made my family sick too. And some of my family members got very ill because of it. Thank God we're all still here. Everybody made it. But it's just something that you don't want to go through. But I am thankful that we made it out.
Gabrielle, thank you for sharing your story. Let's bring up all the panelists because I want to go through a journey here. We've laid the historical foundation of why the distrust with the medical system may be there between African Americans and the system. But let's start with the word accessibility for a moment. Before we all went live tonight, we had a conversation about the fact that, new president takes office, he finds out there was no plan for distribution. But just 2 weeks before then, we found out there was no stockpile, as we had been told, as governors have been told. And so we now have this issue with people wanting to get vaccinated, and there's not enough supply. And now we're struggling to figure out, we're going to get there, but there's not enough supply. I'm just going to ask you, Dr. Washington, to start us off and just start talking about the issue of accessibility and supply and how you're feeling about all of this as a medical professional.
Well, thank you for the question. I think what became very obvious to us very early on from a hospital perspective is the lack of a national plan for a pandemic. By that, I mean very clear and concise communication, very clear and concise direction on what to do with resources that may be in short supply, PPE, ventilators, distribution of those kinds of things. And so you had a variety of institutions, states, and others doing a variety of things on their own just to survive. And we are part of a large hospital system, 185 hospitals throughout the country. So we were able to mobilize some items from a state that didn't have much COVID to a state that needed it a lot. So we were fortunate in that arena. But if you're a small hospital in rural Colorado, you don't have that advantage, and it's very difficult to get those supplies, for example. I think the other thing that was lacking at the onset is that we didn't realize what COVID was doing. And that's why you saw medicine try a variety of treatments without clinical trials. And people thought that, well, nobody knows what they're doing. It's not so much we didn't know what we were doing, we didn't know what would work best. And that's one of the reasons why, Mr. Mayor, if you can contract COVID now as opposed to a year ago, you have a much greater chance of surviving because we are treating it very differently than we did initially. So that's hopeful. But I think we learned from this that we need a better strategy on how to manage a pandemic, because this will not be the last pandemic we see. There are a lot of nasty viruses out in nature, and it's just a matter of time before another one rears its ugly head.
Dr. Richardson, do you have any thoughts there on the same question with regards to accessibility? And we forget, as Dr. Washington showed us, that, we forget at the beginning of this, we were having trouble getting gloves, gowns, ventilators, remember all that? And now we're running into a similar issue with the vaccine.
Yes, and so I think that's one of our biggest problems is just the supply. But I do want to remind people that this vaccine is free. You don't have to be a citizen to get the vaccine. Those are two things. If we want to look at the positive side of it, we really don't have control over how much vaccine we will get. But I do think that all the systems are working on processes. I heard the mayor say that, the city is leading with an equity lens as far as distribution of this vaccine. And so I think we're a little bit behind the curve on that, though, because that probably should have started a little earlier, but at least people are thinking about that and trying to determine how to get this vaccine to the people and meeting people where they are. But we're still faced with the limited supply, but people are developing strategies. I think you all may have heard about a couple of church vaccination events that occurred. I've gotten great feedback on that. And so meeting people where they are, letting them know it's free. If your health system has developed a process, which at Kaiser, they've developed a process where people can get in line. You're getting in a virtual line. Even if you don't have a computer, you can call in and get on the line. And then when your time comes up, you can schedule the appointment. It's just a matter of, from the top, we need a better strategy. And I think our current administration, Biden, Harris, are really planning on developing a strategy to get people taken care of, to be more expeditious. But I would encourage people to be patient. Mm-hmm. There is light at the end of the tunnel. We hear President Biden talking about 100 days. That's really like 3.5 months. I mean, 100 days doesn't sound so long, but that's 3.5 months. We're in January. And so it will take a little time, but you still need to wear your mask, wash your hands, social distance, and we'll get there. Just be patient. I have a lot of hope that we're going to get there.
Terry, thank you for that. I want to take the public that is viewing this through a journey for the city. Right now, it's the federal government passing the vaccine through to the states. The states are laying the framework for how and when people get the vaccinations following federal guidelines and protocols. The city cannot really modify that whatsoever. We can request certain groups to be added, but it's really the state that drives it. And we're going to go through this because there will come a time when the city will have greater discretion in terms of how we can get to certain community demographics. To Dr. Richardson's point, I made the point that we're going to look at this through an equity lens. There are some communities we know would be overlooked. We know will have challenges accessing the vaccine as it becomes more readily available. We are now in phase 1B in Colorado, which means our 70-year-olds plus and older are getting the vaccine, along with our healthcare workers who were not part of the first phase or phase 1A, and our frontline workers and essential officials, and including Gabrielle Franklin's group, frontline journalists, and maybe grocery store workers. And then we move into phase 2 this spring and summer. And we will have folks who will be in higher risk individuals who are between the ages of 60 to 69. They may have underlying conditions, as Dr. Washington pointed out, and other essential workers as defined by the state and federal government. And again, you'll hear the city of Denver begin to share a little bit of, or at least insert our thoughts into some of who should be essential workers as best we can. But I think this is where you start getting to teachers and others who will be vaccinated in phase 2. And then in phase 3, that's the summer. That's when I will be eligible to be vaccinated. Others on who are watching will be eligible to be vaccinated. Gabrielle's generation will be eligible to be vaccinated. It is in this phase where the city will have even greater flexibility or engagement. But I will tell you that I was part of a group of mayors that shot a letter to President Biden and requested that cities in phase 1B going forward have greater involvement so that we can get to our more vulnerable communities, those that are in food deserts, those that don't have access to healthcare systems, those who maybe not have a pharmacy near them, where we need to get more mobile and go to where some of our older adults are who are not in congregate living facilities, who may be sitting in their homes but can't get out to be vaccinated. So we've asked for greater control so we can have greater flexibility. And again, homeless individuals, for example, our neighbors who are homeless, those are folks we deem who would have a harder time accessing the vaccine going forward. I want to go to Terry Gentry for just a moment. And Terry, you know what, with the fragile state in terms of how African Americans view the healthcare system, and then we have the turbulent rollout of the vaccine, where it's not a sure thing. We've all talked about the fact we're getting calls from many of our friends and associates who are older adults who are maybe 70 years old and older. And are having a challenge to find out where to go. How do I get this information so I get vaccinated? How do you think that helps with the effort to strengthen the trust between our community and healthcare system when we're having such a difficult time with accessibility and people getting the information they need to figure out how to get vaccinated?
Well, I think we face quite a few challenges. Just historically speaking, there's so much distrust and so much discomfort that I think hopefully this forum is going to make a difference. And when you see people that look like you encouraging you and getting the vaccine, it gives you a little bit of hope that it's going to be something that you can move forward with. But talking to a lot of folks in my circle, still so much uncertainty about this process. Just hasn't been, I think watching the rollout of the vaccine for a lot of folks felt like it was going too fast.
Mm-hmm.
And it felt like it was so much involved with capitalism and privilege in it. And then we've seen some interesting things on TV about folks flying from all over the world to come to Florida to get the vaccine. And so just the disparities and the people in the communities, I think one of the best things that happened was order, AME Church and the Black churches getting folks into their churches because they've always been part of our leadership in our community. So hopefully that would be one resource that we can continue to take.
So trusted institutions will be important.
Absolutely. The
churches and the other, yeah.
Yes. And like I said, in the Colorado Black Health Collaborative, Dr. Richardson, I've seen the impact that they've had on our community as a resource. So I think that's going to be a good place to go too, is to them and the churches to get.
Will you be vaccinated, Terry?
Yes.
And will, how important is it? And I want to bring in Gabrielle Franklin in this same question. How important is it for the public to see, your contemporaries to see you get vaccinated on camera, or Dr. Washington get vaccinated on camera, or Dr. Richardson or Gabrielle or me? How important is that?
Well, I hope that it affords a little trust. I feel like historically with all the stuff that I'm familiar with in our experiences, I'm going to step forward and do this. And I have a lot of healthcare folks in my family that support this endeavor. I've got aunts and uncles and cousins and that are waiting their turn to get the vaccination. And we have a lot of conversations about that. And I think as a collective, we're all going to step up and go take care of this to make sure
Love it.
that we are protecting our family members. I don't want to expose my dad,
Yeah.
Uncle Joe. So I'm just so ready to get this vaccine and make sure that I'm safe and that I am. And it's not even about me. It's about making sure that I'm not imposing this on somebody else. That's what I'm concerned about. Is this isn't about me. This is about making sure that I'm not impacting your life.
Yeah.
So.
Thank you for saying that. I have an 81-year-old mother who I've not been able to hug since March. And that is a very common thing between us. I love to give her what I call a smoochy hug and hug her hard and love her to death. And I haven't been able to do that since March. Dr. Richardson, your mother was one of my teachers. I hope you got her lined up, or she's received at least her first dose or ready to receive her first dose. You wanted to chime in.
Yeah, I want to chime in because and she's fine, but I wanted to chime in because I did get my vaccine as a healthcare worker. They called me around Christmas time, and I said, "You've got to be kidding." But the week after Christmas, I went in and got my first shot, and I was surprised. I really did it for the community because I've researched this vaccine, and I wanted people to know that I think it's safe and effective. So I had them take my picture when I went to get it. I put it on the Colorado Black Health Collaborative Facebook group. And then I started getting calls from people. Thank you for sharing. Someone in Montbello said, "Hey, can we use your picture in the newspaper so people can see that a trusted person in the community has gotten this shot already?" And I've heard from a lot of different people. They really appreciated that. And I've been talking in a lot of different forums, but just seeing the picture of me getting this shot just really made a difference for the community. And I really did it for the community.
That's great. Gabrielle Franklin, let me ask you a question. You identified yourself as a millennial, and I have millennials on my staff, and I'm the father of 3 millennials, and several have between staff and one of my kids have expressed skepticism in taking the vaccine. So I'm going to ask you, as a journalist, what do you, as an African American and someone who is a COVID survivor, what do you view as your role in journalism to help spread the word about how important this vaccine is?
For sure, definitely. It's something that I think is vitally important. We have to continue to have conversations like this, because what I'm noticing now is that it's so widespread that people in our community don't want it. At first, like, you would see people of a certain background not wanting it, but now you see doctors, I know nurses, people who are frontline healthcare workers not wanting to get the vaccine. So that's how deep rooted this is, what we're talking about. So I do think it's important for us to continue that imagery and continue having conversations like this, because it opens the door for people to really learn about the vaccine and learn about the safety of it. So it's something that we're going to have to keep working on. But for sure, definitely, imagery, 100%. We've got to see it.
Are newsrooms focused on this or even talking about it in terms of how they can help do more stories about people of color taking the vaccine?
Definitely. It's something that it's a conversation that a lot of newsrooms are working on. The biggest thing now is once we get the vaccine more available to the community, I think that's when we'll start seeing a rollout, more with the messaging and more just talking to people who have already gotten it, talking to them about how it's been going and trying to get that message out to the community.
Thank you for that, Gabrielle. Dr. Washington, I have a very important question to ask you. Many people in our community and others have said this vaccine was created too fast, developed too fast through the testing process. Protocols were sidestepped. A lot of myths and misinformation out there. Is this vaccine safe, and did it follow the normal protocols?
Thank you for that question, but I'm going to take a prerogative and answer another question prior to that.
You go for it. You're Dr. Washington.
The medical profession and those who are in control of the vaccine are taking this very, very seriously. There was an incident in Florida for a brief period of time where people were, in fact, flying in, jumping the line and getting the vaccine ahead of time. That was very quickly stopped once people figured out that was going on. and the people who were participating in that were appropriately dealt with. So I think that's a true observation, but it's one that did not last very long. I think the other thing that I have to emphasize before I answer your question is COVID can affect all age groups. In our hospital, Rocky Mountain Hospital for Children, we had a premature baby who had COVID. We at this time have 4 patients in our hospital, 1 in our ICU who has COVID. So this can impact all age groups. It is true that the older you get, the less likely you're going to do well with it. But we've had young people, we had 1 under 18 die from COVID. So don't get the impression that you can't get COVID or die from COVID just because you're young. Now, to your question, Michael, this vaccine has been fast-tracked, but there hasn't been shortcuts in making sure it's safe. 40,000 in one trial, 30,000 in another trial, with a 90+% efficacy of making sure you don't get COVID. So I have all the faith in the world. It's a safe vaccine. There have been a few patients who have had side effects, anaphylactic reactions, for example. They say that's less than 100 out of over 2 or 3 million vaccines. So it's not very prevalent, but people pay a lot of attention to that. The other thing I would submit to anybody who is hesitant to get a vaccine, if you have COVID and you're in an ICU and you're on a ventilator and you're on life support, that person would say, boy, I wish I had a vaccine to avoid all of this. COVID is very serious and it can make you very sick. And unfortunately, even nowadays, it can take your life. Mm-hmm. To me, COVID vaccine is safe and we should be able to take advantage of it as soon as you're able to get it.
Thank you, Dr. Washington. That was very good and exactly the message we need to put out there. Dr. Richardson, you want to chime in on the same question?
Yeah, I think using the terminology warp speed led people to believe that maybe some steps were skipped, but these trials went through the exact same processes as other clinical trials. Nothing was skipped, and they really had a premium view on safety. And the important thing about these trials, it also engaged people with chronic diseases, people of color, and oftentimes clinical trials, you hear that it's mostly white males. So the fact that there were 10% Blacks in both the Moderna and Pfizer trials, I think that made me feel good. And the fact that one of the lead developers of Moderna was an African-American female. And she has a wonderful webinar that she attended with some other Black health professionals that described all the steps that were taken and how they were able to get this vaccine out more quickly. Part of it was that a lot more money was put into this vaccine. You had all hands on deck, and they were able to do some of these steps overlapping. So nothing was skipped. Safety was attended to. So I do believe, again, that this vaccine is safe and effective, and we were involved in the trials in every way you can think of. And even the National Medical Association reviewed the trial data to make sure that things look good. So we have a lot of people that have our back on this.
Let me ask you, Dr. Richardson, while you're still on camera. Right now, the vaccines require 2 doses. Can you contract COVID in between doses?
You can contract COVID in between the 2 doses. They still would recommend that you get the second dose after 14 days if you do contract the virus. But it is possible because you don't have full immunity till after the second dose of it. Both of these require 2 doses. There is one in production, the Johnson & Johnson, that will just be 1 injection.
Very good. Gentry, I want to ask you a quick question because I think you hit a point there that I want to make sure we all stress a little more in this call. And that is, taking the vaccine is equally important to your community and to your loved one than it is to yourself, right? To be healthy and to be safe. Can you talk a little bit about that a little more? Because we all have people who are around us that we're coming in contact with. There was a moment when I was potentially exposed to COVID. We knew somebody had just been in contact with, had tested positive the very next day. And the number of people that I had to contact and say, hey, look, I may have exposed you, was enormous. And I mean, I recognize I'm the mayor, but I was also isolated for the most part during that time. It still was a lot of people. I'm thinking about my wife, my mother, my grandchild, who I had come in contact with. So I want you to just talk about on a more personal level how important it is for us to recognize it's not just us that we're trying to protect.
Well, I think about the people. I work in retail. I work in a furniture store, and the age range of the folks that I work with are from, I have a 13-year-old, a couple of 18-year-olds, people that are in my age. I'm not going to say how old I am. So we cover the gamut in age, and the people that come into the store cover the gamut in age and experiences. And my biggest concern is somebody coming into the store. You know, we're all wearing masks, but I've had a few folks come in and challenge that with us. And each time they come in, I'm saying, I hope that they come to realize that they need to take this vaccine because they've put our whole store at risk.
Yes.
And then I'm thinking I have to go home to my husband.
Yeah.
Diabetes. I have asthma. I have an 85-year-old dad, and I have an 85-year-old uncle that I like to hang out with when I can. And I do not want to put their lives at risk. I'd like to see both my dad and my uncle hang out with me for another 20 years if I could. That, you know, and then other aunts and uncles and other family members, I do not want to get something that somebody brings into the store where I work and spread it around because, and someday I'd like to get back to hugging all these folks.
Yeah.
And you know, holding their hands and saying some prayers together with them and just celebrating their birthdays and all of that kind of stuff. So there's so much risk in doing that. And that's what I'm thinking about is I want them to live and I want to be able to enjoy that. And so it's really critical for me to get this vaccine and the folks around me so we can get back to business. So I can do some more 5 Points walking tours and we can open the museum and get folks from all over the world back in there and share the wealth of what Denver has to offer and share some love with some folks. I really miss that.
Yeah, I'm with you there. We have some Facebook questions. Let me see how we're going to get these questions. Do we have, where do I find these Facebook questions, team?
I think we texted them to you, Mayor, but we can read them also if you want.
Yeah, why don't you go ahead and read them? I don't have the text.
Got it, Mayor. So the first one is, it says, what happens, what is messenger RNA? So what is, Dr. Richardson, if you could explain what mRNA is. So we hear that term often associated with the vaccines.
That is Teresa Marchetta, Director of Strategic Communications, the Mayor's Office. And Teresa, I see the text now. So Dr. Richardson, come on up. Thank you.
Hi there. So yeah, both of the vaccines that are out there now are mRNA. So this is injected into the muscle. It goes into the cell, and the mRNA, messenger RNA, tells the body to develop the spike protein, which is what the actual COVID virus uses to attach to your cells and then, you know, replicate or infect your cells. And so it really, you don't get the virus is not injected into your body. This is just some genetic material that goes in and instructs the body to develop this spike protein. So it's a relatively new technology, but it actually has been around since 1990, and they've kind of perfected it. And I think it's a great technology, and it's allowed us to really get to a vaccine much quicker than we ordinarily would if we're using some of the older technologies.
And Mayor, if I could add
Yes,
just an additional comment on what Terry said, you cannot catch, repeat, you cannot catch COVID from this vaccination. It's impossible. Also, this messenger RNA is very short-lived. so it will not change your own genetic makeup. So it's not going to change your own cells, and you cannot pass it on. So it will not change anything for your offspring, your reproduction, breast milk, or anything of the like. So you may read about that, but none of those facts are true.
Appreciate that. And it again goes to the point that this is a safe vaccine, and people need to take it to protect themselves and those who are around them, who love them. I wanted to make sure, Gabrielle Franklin, I wanted to make sure you didn't have a comment. I thought I saw, did I see movement on your screen? Okay, let's make sure. So, okay, I thought I saw something. I want us to go and recognize and share some thoughts around where we're going to have some vaccinations. I want the community to know there are some events being planned. We cannot release them yet because we want to make sure that by the time you chime in, or at least you try to get online and get registered, or get a loved one registered, or call, that everything is set up for you. But coming in a few days, there will be some events, some vaccination drive-throughs that will be set up in the city of Denver. And the city is not running these events, but we are participating, helping them to get started and have what they need to be successful. We do know, maybe I can have Terry talk briefly about Kaiser.
You know what? And I was sitting here, I forgot the latter part of the messenger RNA. You develop the spike protein, and that stimulates your immune system to develop antibodies and immune cells so that when the virus comes in, your body says, hey, let me attack this and take care of it. So I left out the latter part of it. And I wanted to make sure that people are clear, because I left off with just the spike protein, but that induces the body to develop the immunity. So that's what I want to say there. And then what was the other part of the question? I was so busy thinking about that.
Kaiser's a big player in vaccinations. You guys, of course, have your own patients that who are part of your system, but others might be able to get vaccinated at Kaiser. You made a comment before we came on air about that. You want to just share that?
Yeah, and I was actually hearing from some of my patients about the vaccine and, could other people get it at Kaiser? And actually, these vaccines are coming from the federal government. Our leadership has reminded us these vaccines are not just for Kaiser patients, they're for any person in Colorado. So I know the governor's site has the information on how you can sign up at Kaiser. Our patients are being contacted using different methods. If they have computer, they're sending notes out that way. If they don't access a computer, they can call in, and everyone's getting in line. And we actually have 14 sites where this vaccine can be obtained. But you do have to register when your time comes and get on the list.
Fantastic. Let me ask a question that came through Facebook. Where can here's the question. If I am vaccinated, but my grandfather is not, will it be safe for me to see and hug him?
This is Dr. Washington. We don't know the entire answer to that question, but the advice we've been given is that if you get the vaccine, first and foremost, the vaccine will prevent you in 95% of the cases from getting sick from the vaccine. The data does not show one way or the other yet if you are not able to pass the virus on to someone else. In other words, you can contract the virus into your nose and be able to pass it on to someone else, even though you yourself are not sick. So the current advice is, even if you're vaccinated, you should not expose yourself to someone who is unvaccinated until we know more about it. And that is why, even if you're vaccinated, the recommendation is that you still wear a mask and you still socially distance. Now, there's that term called herd immunity, and that simply says once 70% or more of a general population has been vaccinated, the virus is going to have a hard time sticking around. We're a long way away from that 70% vaccination rate. So the short answer is, if you're vaccinated, still consider yourself possibly contagious.
Thank you. That's a very good point. Dr. Richardson, anything?
I was going to say, so definitely don't give them a hug. And everybody mask up. Keep your mask on. We still have a ways to go on that. Continue to be patient. Continue to wear your mask. Wash your hands. Social distance.
Very
and
good.
be patient.
That is exactly the message we're going to keep giving folks. We want to remind people, as Dr. Richardson and Dr. Washington both said here, wear a mask, social distance, and wash your hands while in public. We are getting quite a few people asking, where can I get information on where I get vaccinated? And we're going to be posting on the city's website some of those websites that you can go to get information. And we also encourage you to call 311. They'll be dispensing information there as well in terms of where you can go to get vaccinated. Dr. Washington, Dr. Terry Richardson, any thoughts on how you would answer that question in public if someone says, where do I go get information?
Well, I think that you pointed it out. There are many websites around, there are phone numbers around. The governor has sites posted. City of Denver has things that will be posted. Our hospital system has information. Kaiser has information. It's going to be frustrating, I think, because it's not going to be instantaneous, but people need to be patient as we set these up. And please get the vaccine as soon as your time comes up. The other thing, if you have an appointment, please keep it, because once that vaccine is reconstituted, it must be administered. So do not miss an appointment, because that vaccine cannot go to waste.
Very, very good. And we want to remind folks, you can also go to denvergov.org, and we have a website there. And as does the Colorado State effort under the governor, covid19.colorado.gov/vaccine. But if you go to the city webpage at denvergov.org, you can see some of the general information and links to the state page. Let me ask we have about 4 minutes left. I got to ask this question of the doctors. I want to make sure this constituent gets her answer or his answer. It doesn't give me the gender. I'm 63 years old with coronary disease, type 2 diabetes, and have cancer. Am I considered high risk enough to qualify for the vaccination at this age?
Not over 70, so not yet, but you certainly will very soon. In the meantime, please take care of yourself. Type 2 diabetes, watch your diet, exercise, do what your doctors and healthcare providers say, because you also have a responsibility for your own health while awaiting the vaccine.
Thank you. Dr. Richardson?
Yes, and because of your age, you're in age, even with those comorbidities, you are in phase 2. So we're not quite there yet. As we talked about earlier, there's limitations in the supply, but be patient. We will get to that phase.
And the last question was teachers. Are teachers in 1B? I believe teachers are in phase 2, correct?
That's my understanding.
That's my understanding as well. They were initially in 1B, and the state reclassified teachers. They are now in phase 2. Listen, that's all the time we have tonight. We as a community cannot thank all of you, Dr. Terry Richardson, Dr. Reginald Washington, Gabrielle Franklin, Terry Gentry, for your phenomenal participation on this panel. This was such an important conversation in the life of our community. I want to thank Denver 8, my communication team led by Teresa Marchetta, as well as Gabrielle O'Brien, for her tremendous participation. Jen, Shavoni, thank you for chiming in. You all have been phenomenal in helping us to put this together. This is just one of many conversations we're going to have in the community. Again, we mentioned Latinx community, Asian community, Indigenous community. We are working to encourage everyone to take this vaccination. In the meantime, and even when you get your vaccination, until all is clear, we ask everyone to wear a mask, wash their hands, and social distance. And if you can, avoid gathering in large groups or small groups, particularly people who are not part of your family. And when your turn comes in the phase, get vaccinated, not just for yourself, but for the entire community and those who are around you, who you love and see every day. Again, everybody, thank you. Thank you very much. We can't thank you enough. That's it. That's all the time we have for tonight. God bless you all. Be safe.